Hi, this is Dr. Barry, and I have to tell you, I was very emotionally upset doing the research for this video, and watching it, you may be quite upset as well. I did not know such things still occurred in modern medicine. If you're a victim of past sexual abuse, you may not even want to watch this video. It may be too upsetting for you. I'm going to be talking about today the performance of pelvic exams, vaginal exams on female patients who are unconscious and who have not given consent. This is a thing that still happens all over the world in modern medical practice, and I think it needs to stop now. A viewer sent me an article that was linked to healthywomen.org, and the title of the article was "Hospitals are allowing medical students to perform pelvic exams on unconscious women without their consent." And my spidey sense immediately said, there's no way that that's still happening. That's got to be bullshit, or that must be an article for 10 years ago. Articles from 2021, April, and absolutely, as I delved into the research for the making of this video, this still happens all over the world in modern society to unconscious women without their consent. I went to Snopes.com, not always trustworthy, but in this case, I don't think this issue's been politicized enough that they're going to have their own spin on it. And sure enough, there's an article from 2018 saying that this is still legal in 45 states in the United States and has been explicitly outlawed in 5 states. Now, let's talk about that for a second. Is this something that a state legislature and a state senate, should they have to debate this and go to the trouble of passing a law? Isn't this something that doctors should just know better than doing? I know as a medical student at the University of Tennessee Health Science Center in Memphis, we had something called gynecological teaching assistants. And so my third year of med school, we went to a medical office building in Midtown, and there were ladies there, women who had either, they were doulas, or they were just women who had had a bad experience with a pelvic exam in a doctor's office, and they had decided to either volunteer to let medical students practice with our fumbling fingers on how to do a proper female genital exam. And so they were very patient, they were very caring. It was a very weird situation. I promise you, it was very uncomfortable for all the medical students, male and female. But looking back now, I can't tell you how much I appreciate these women sacrificing their time and their bodies so that we could actually learn how to do a pelvic exam, a bimanual exam properly, so that all of our future female patients wouldn't have to suffer. But these women were conscious. These women had given their consent to train us medical students in how to do a proper bimanual pelvic exam on them. They gave us immediate feedback. No, that's too high, that's too low, that's too hard, that's that's too gropey, that's too whatever. And so that we got immediate feedback from these women saying, yes, that's right, no, that's not right. So that I hope that we all wound up being capable of giving a very thoughtful, gentle pelvic exam to a woman. But there are still many hospitals, many residency training programs, and many evidently medical schools who allow medical students to give bimanual pelvic exams to unconscious women. So evidently what happens at these hospitals, and these can be large teaching hospitals in metropolitan cities, or they could be very small hospitals that still train medical students and residents. And these don't have to be large metropolitan hospitals. So evidently what happens is that a woman may come in for a cosmetic procedure or a shoulder surgery or toe surgery, and once she's been anesthetized and unconscious on the operating table, the hospital allows the doctors to bring in medical students or residents to perform bimanual, which means that one hand goes on the woman's stomach and 2 fingers go inside the woman's vagina, to perform these exams on unconscious women who have not given their consent for this procedure. And yes, it is a procedure to be performed on them. I found numerous articles about this, 2 on Snopes.com and then other articles. And then I also found some legislation that's in front of various state legislatures and senates to be debated and hopefully passed into law. But my point is, this shouldn't have to be something that state government makes illegal. This should be something that any doctor who's taken an oath to do no harm, they should absolutely know that this should never be performed on an unconscious woman who hasn't given her explicit consent for you to cross the plane of her vagina. This is not okay. What do you think about this? Please tell me. I want your feedback. Doctors have to be trained. Medical students have to be trained. Yes, of course. But there are ways around this. There are models, latex models that medical students can practice on. There are women who will volunteer and donate their time to give medical students a chance to do this. Also, I think it's perfectly ethical and legal if there's, say, for example, a woman in labor and the doctor, the attending physician does a bimanual exam to check her cervix and then says, hey, is it okay if the resident checks you as well so they can learn? And the woman has every right to say no, but also most women are like, yeah, it's fine. Everybody's already seen my business, so, it's fine. And then you could say, is it okay if one of the medical students checks you so they can learn, so they can take better care of women in the future? In my experience, 80% of women would say, yeah, it's fine. I don't mind. Everybody's, I'm exposed to the world. I'm spread. It's fine. Go ahead. Get your learning. But if a woman is unconscious, if she has not given her verbal consent or preferably has signed a consent form that says, yes, I explicitly consent to you doing a vaginal exam on me, this is unethical. Is this sexual abuse? What do you think? Is this legal sexual assault? What do you think? I tend to say, yeah, this is probably something that an attorney could get involved in. This should not be happening anywhere in the world where modern allopathic medicine is practiced. I'm speechless still. Looking at these articles, I'm just like, really? But yeah, I've verified this is absolutely real. It's a thing and it's still happening all over the world. So I think two questions should be coming to the mind of women. Number one, if you've ever had a medical or surgical procedure where you were under anesthesia, did this happen to you? And so I think that's a valid question. The only way to know for sure would be to request the billing charges to see if there was a billing code for a bimanual exam or for a pelvic exam that was recorded. And if you were in the hospital for shoulder or fingernail surgery and you got charged for a vaginal exam, that's probably weird and you should probably look into that. The second question that comes to mind is, will this happen to me in the future? And so even though it should not be your problem, it is. And here's what I would recommend you do anytime you go into a surgical center or a hospital in the future and you know that you're going to receive some degree of anesthesia that is going to render you at least some degree unconscious, you need to tell your attending physician, your doctor, I do not consent to a vaginal exam by you or any resident physicians, training doctors, or any medical students. I shouldn't have to say this, but just in case, I'm going to tell you now, I don't consent to a pelvic vaginal exam. Let me apologize to you for you having to watch this video. I'm sorry I had to make it. Let me apologize for all MDs and DOs out there who would ever do such a dastardly thing as violate a woman's pelvic region without explicit informed consent. You may very well feel like you need to share this video with female friends and family members, especially if somebody has a surgical procedure coming up. They probably need to know that this type of thing still happens even in modern society. Oh, just to let you know, the Association of American Medical Colleges do not condone this. They have actually come out with a very strongly worded statement calling this unethical and unacceptable, and I totally agree with them. The American College of Obstetrics and Gynaecology also came out with a very strongly worded policy statement back in 2011 saying this is no bueno, don't do this. But yet there are hospitals and medical schools and residency training programs that evidently still think it's okay to put your fingers in the vagina of an unconscious woman who has not given her consent. What's your definition of that act? I mean, there seems like there's a word for that, a legal word, but I'm not trying to pass judgment. I'm not trying to cast blame. I'm just saying, if there are any healthcare providers out there listening to this, please stop doing that. That's not okay. That is not ethical. That is not something that you should have been trained to do, and you should never have been trained to think that it's okay to violate a woman when she's unconscious. This practice has already been explicitly outlawed by the state legislature in Hawaii, California, Illinois, Virginia, and Oregon. But and then in 2019, there were several other states who were exploring legislation to outlaw this egregious practice. But I'm not sure if this is still legal in your state or not, so you better check before you have any surgical procedure that requires anesthesia for you. Hopefully the next video I make for you will be less upsetting than this one. This is Dr. Barry. I'll see you next time.